everyone. Today's program is Nourish Your Bones and Joints. It was created by North Dakota State University, and I have Karen Richey with Marshall County Extension Office with me here today.
Well, thank you for asking me. This is something that I have taught in the past, and I think it's really important, and it doesn't matter what age you are. So I think as we delve into this, you kind of find out that you really do have to take care of your bones and nourish them. So with that, let's get started. Okay, so bones, obviously collagen provides that framework for your bone, and obviously many of us realize that calcium also strengthens your framework, so to speak, and that's why calcium is so important. And when it comes to a new bone, it's being formed no matter what age you are, so there's lots that goes into it, whether it's nourishment or whether it's physical activity. So as you see here on the slide, what's in them? Well, you can see that it's living tissue mostly made of collagen and calcium. And what do? Well, they do support our body and make it possible for movement. And what happens when they go bad? Because as you age, a lot of times that's what happens. The bone will break down and surpass the bone construction. So again, we got to take care of our bones.
On this slide, we're going to take a guess. We're going to find the picture that matches each bone disease. So we have the bone disease rickets, osteoporosis, osteopenia, and osteogenesis imperfecta. So which picture goes with?
Well, let's see. Okay, so rickets goes with, well, as you can see that lower picture, and let's try the next one. Okay, and that's where you have holes in the bone, so to speak, osteoporosis. And osteopenia would be a finer sieve, almost little tinier holes. Okay, so it's the start, so to speak. And imperfection is when they actually break. Good guesses. Okay, when a bone goes bad, you can see that we talked about those 4 issues. And so osteopenia is basically the bone loss that is a precursor to osteoporosis. Other causes of osteopenia and osteoporosis basically would include excessive alcohol consumption, could be smoking, it could be excessive intake of substances that affect your calcium absorption. And some of those things are caffeine, which a lot of us like to have our caffeine in the morning, and phosphorus, as well as calcium. So these are all important things, and you have to understand how they play a part in all 4 of these scenarios. So if osteoporosis isn't for you, what are you going to do? What do you think?
Eat healthy.
Eat healthy. So right. You want to have a healthy bone, so you want to eat healthy, eat right. What else could you do?
Exercise.
Absolutely. You could exercise. The more exercise you do, the stronger your bones get. Now, in my case, I have to take a supplement, okay? And so a lot of times that supplement is calcium, so I have enough for osteopenia, and so that's why I take a supplement. And then there's also lifestyle changes. So if you were a smoker, or if you drank alcohol or drink alcohol, you may want to watch those because again, all of those enter into it.
What do you think? Which nutrients help build bones? Caffeine, calcium, vitamin K, vitamin D, sodium, boron, and magnesium. So the ones that build calcium are vitamin K, boron, calcium, vitamin D, and magnesium.
Yeah, caffeine is not going to help build your bones.
Yeah.
No. Okay, so we definitely have to eat smart, okay? And if we're going to eat smart, we want to make sure to be careful not to replace milk with soda, drinks, or other beverages. And make sure that you enjoy other milk products such as yogurt, maybe cheese, My favorite is ice cream. But anyway, ice cream would count, but you don't want to count the fat calories in it. Cottage cheese, cream cheese are among some of the best sources of calcium. And you want to make sure you get enough, but not too much protein in your diet. And most people in the United States consume ample amount of protein. So again, drink your milk, eat plenty of greens, limit that alcohol, and reduce or eliminate smoking is definitely the things that we have to make sure we practice. So let's talk a little bit more about calcium, Shannon.
So calcium. So plain yogurt has 415 milligrams in an 8-ounce cup of yogurt. Sardines have 324 milligrams of calcium in a 3-ounce container. Fortified orange juice has 300 milligrams in an 8-ounce glass. Fat-free milk has 300 milligrams in another 8-ounce glass, and then spinach has 59 milligrams if you have 2 cups of spinach.
Yeah, and I want to go back to the orange juice, and you have to make sure it says fortified with calcium, because orange juice does not normally have calcium in that. So weight-bearing exercises is another way that we can increase bone density. And so if you're doing any of the things that you see here on the slide, whether it's going up and down steps, a step master, dancing, movement of any type of thing, weightlifting, even good old walking, that helps as well. So you want to make sure to increase your exercise as well. So let's talk a little bit more about that bone building supplements, because I think that's important. Do you want to talk about that?
Sometimes you need supplements when you can't get enough nutrients from your diet, such as with reduced calorie efforts and calorie diets. Most forms of calcium are absorbed equally, but if you experience gas, bloating, or other discomfort, you should try a different form of calcium. Talk with your doctor about taking vitamin K if you are on a blood thinning drug. Other supplements that may be important for bone health include magnesium and boron. So again, those bone building supplements are vitamin D, calcium, vitamin K. For vitamin D, it aids in calcium absorption. And the daily needs are 400 to 2000 IU. Calcium material for bone building, your daily need is 1000 to 1300 milligrams a day. And vitamin K, it directs calcium to your bones, and you need daily at the 70 to 125.
So again, those are amounts that you should have average on a daily amount. Now, if you are deficient in any of those, make sure you talk to your medical provider, and they may increase that amount if you need to have that amount increased. Okay, so we've talked about bones. Now we need to talk about joints, and I think is what's in that, what's in them. And as I said before, cartilage and a lining called synovium is basically a part of that. And what do? Well, they hold our bones together and make bone movement possible. And so cartilage is extremely important. And when they go bad, that means we have diseases that can actually wear and tear and can cause some joints to deteriorate, resulting in bone rubbing against bone. And I am going to share something about myself, actually, in regards to joints. I have for years clenched my teeth. And so now I have no cartilage left in my jaw joint. So again, medical issues have evolved, and so I'm having to take care of those. So, even simple things like that, you have to think about. So don't let that go, because it is painful. I will tell you that. So joints, the dark side, and let's talk about that.
So rheumatoid arthritis affects 1.3 million Americans. It's a chronic inflammation of the joint lining, and its causes unknown. Symptoms include fatigue, morning stiffness, low-grade fever. Osteoarthritis affects about 27 million Americans, and it's a term for a group of diseases that result in joint breakdown. Causes include hereditary, overweight, injuries, overuse, lack of physical activity, Symptoms include joint pain, stiffness, bone growth. Other joint disease include lupus, tendinitis, fibromyalgia, and gout. I know unfortunately my father, who was in construction all my life, has the osteoarthritis and now is having gout on a regular basis, which is really painful.
Oh, that's too bad. Yeah, so again, we don't think about these things when we're younger, but
No.
boy, it hits us when it comes later in life. So did you know, okay, so we're gonna do a little quiz here. And the first one is, how many Americans suffer from osteoarthritis? Okay, we talked about it, 27 million. All right, next one. How many types of joints does the human body have? Guess.
20. I'm gonna guess 20. No?
Three.
Three.
Okay. And then what is the average annual cost of osteoarthritis for those who suffer from it? And that's about $2,600, okay, which probably in today's day might be low.
Yes.
With medical prices going up. So what joint disease is characterized by morning stiffness and heated, swollen joints? And that would be rheumatoid arthritis. So if you got those right, you're doing good. So we're going to move on to pay now or mobility later.
Pay now, mobility later. This is going to look into extras such as supplements, exercise, and also diet. Things that we all want to do so we can still play with our grandkids as we age.
That's right. So let's start out with exercise and the benefits of it. Well, we all know if we exercise, we have weight loss, and hopefully that's the greatest part because less weight equals less strain on your joints, okay? And if we also decrease the risk of osteoarthritis, we then have those who lose weight may actually cut their risk of osteoarthritis in half. That's huge.
Yes.
That's huge. Okay. And if we increase our bone density, we're basically exercise such as walking for 30 minutes each day may not only stop bone loss, but also increase bone density. And that's important because the denser your bones are, the stronger they will be. And then we want to make sure we improve flexibility because actually flexibility, that what can cause improvement in pain, disability, as well as performance in people with arthritis or osteoarthritis, excuse me. So all of these things really are a win-win when you think about it when it comes to exercise as we talk about our joints and our bones.
Good ideas for exercise. So swimming is a great idea. Water aerobics can decrease swelling and increase circulation to joints and muscles and puts less pressure on your joints during exercise. Dancing relieves stiffness and keeps flexibility. Strengthening exercises strengthen those muscles and joints. Biking may also lessen joint swelling.
So again, we want to do some exercise tips, and I think that's the most important thing that you think about because low impact exercise is what you're maybe looking at. And that's an exercise where your heel is not hitting the ground with great force. And if something causes you joint pain, obviously stop that activity and try something else. There's lots of things you can do for exercise. It doesn't have to be painful. You also want to make sure you take frequent breaks from repetitive exercise and activity, and then make sure you practice good posture while sitting or standing. So when you look at these do's and don'ts here on this slide, so don't do anything that causes pain. And then make sure that you do some of these things, which is definitely making sure that you stretch and warm up before using those muscles. And again, 30 minutes of exercise a day would be great if you can get that in. It can be walking. But again, try to take some breaks if that's too much for you. Just the main thing is that you're moving. And so those are some tips that we have for you.
Eat smart for healthy joints. So make sure you drink plenty of water. Water keeps those joints lubricated. The usual hydration recommendation is 1 ounce of fluid for every half pound of body weight. Enjoy your fruits and veggies. They may help to prevent osteoporosis. Then eat a balanced diet. Watch out for bad diets that only provide short-term results, but long-term consequences.
Okay, so it's not only eating, but then if you can't get enough, you definitely may need to take some supplements. And again, there are some cautions that we want you to be aware of. And that is always talk with your doctor before adding a supplement to your diet. They may do some medical testing for you to see exactly what your body needs. Because many supplements interact with prescriptions of other supplements, which could cause some serious consequences. I know a lot of things that interact, and so another person, not only your medical provider, but your pharmacist is a good one to talk to. And if you experience any negative side effects or after taking a supplement, you want to stop taking that and control or contact your doctor or your pharmacist about those reactions. Always follow the directions and serving size on the bottle unless your doctor has recommended otherwise. So there are some cautions when it comes to supplements. But again, buy those supplements from reputable companies and not just something off the line, so to speak. So there are some things I want to talk to you about when it comes to supplements, and maintaining vitamin K level actually may prevent osteoarthritis. When we talk about supplements, we might be talking about glucosamine. It's made from the exoskeleton of shellfish. It's usually combined with coenzyme or MSM for added benefits. And it takes about 4 to 6 months for results for that when you take glucosamine. Hyaluronic acid is another one, and it comes from the combs of roosters, actually, and it may reduce pain and increase flexibility. And only hyaluronic acid injections have been studied extensively, not the supplemental form. Another one would be chelated fatty acids, and they are made synthetically, and it does not reduce the risk of osteoarthritis, but it may relieve some of the symptoms. And it comes in pill form or in a topical cream, so to speak. So some of these things are out there. Again, make sure you contact your doctor or have that conversation with your medical provider or pharmacist.
Other supplements include omega-3, tartary, and turmeric. These are targeted for those who have inflammation and rheumatoid arthritis. So omega-3, usually found in fish oil or flaxseed oil supplements. It may reduce your morning stiffness and tender joints. However, you should not be taken with aspirin or other non-steroidal anti-inflammatory drugs. Then tartary is made specifically from the montmorency cherries and may have anti-inflammatory effects. More research still needs to be done on this. Turmeric is an Indian spice, also known as kurum. One study showed that it may reduce the risk of rheumatoid arthritis and may have anti-inflammatory effects.
So there's lots of things out there, but again, I want to caution, always check with your medical provider or your pharmacist. So another alternative might be acupuncture, and it's actually a traditional Chinese technique, and studies have shown that it can actually reduce the pain and increase mobility. As you can see here in the slide at the bottom, there's multiple needles are inserted in different parts of the body to basically stimulate a response. And long-term benefits have not been studied. So again, check with your medical provider.
Hydrotherapy is another, and the term is used for multiple therapeutic water treatments. It helps increase in circulation and may aid in symptom relief. And it includes jacuzzis and mineral baths.
Well, I don't know about you, but I do have a neighbor that has a jacuzzi and he says it does wonders for him and it's outside and I'm thinking, when these cold temperatures and I see the steam coming off, I'm thinking, I'm not sure that's for me, but it is for him. He says it feels good. So all to his own, I guess. So the next one is a to-do list. And I think those are the things that we want you to remember. Include more fruits and vegetables. And that includes fish, flax, walnuts, and milk. To build some of those bones and joints, and find exercises that are fun and fit into a daily routine. Hopefully you're doing that already, but if not, make sure you increase your exercise. And I know this is something you do. You fill a water bottle each morning and drink throughout the day. You've got that water bottle with you all day. I agree with you. Water helps the body in many ways. So if you want to learn more, we have additional resources for you. You want to tell about that?
We have a couple of handouts that are included with this presentation that you can look at. One's called Nourish Your Bones, and the other is Nourish Your Joints. So a lot of information in there about different things that you can add to your diet to increase your bone strength, and then how to stay fit and knowing knowledge, what your knowledge is about joints, and then try these joint-friendly fitness ideas. So we give you some exercising tips and considerations when looking at your diet as well as your exercise plan. Then you can go to the North Dakota State University Extension Services and find more information there, as well as the Arthritis Foundation or the National Osteoporosis Foundation.
Well, I think we've given them a lot of information. I think the thing about it is will they adhere to it? Yes. So good luck and thanks for having me.
Yes, and thank you for coming.